This multivitamin and iron product is used to treat or prevent vitamin deficiency caused by poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for the body and help maintain good health. When taking Wescap-C DHA 35 mg, 1 mg, 200 mg capsule multivitamins, it is best to take it by mouth, usually once daily or as directed by your doctor. It's important to follow all the directions on the product package and not take more than the recommended dosage. For best results, take this medication on an empty stomach 1 hour before or 2 hours after meals with a full glass of water. If you experience stomach upset, you can take this medication with food, but avoid consuming antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication, as they may decrease its effectiveness. If you are taking the delayed-release form or extended-release capsules, it is important to swallow them whole and not crush or chew them. This can release all of the drug at once, increasing the risk of side effects and decreasing absorption. It's essential to take this medication regularly at the same time each day in order to get the most benefit from it. Some common side effects of Wescap-C DHA 35 mg, 1 mg, 200 mg capsule multivitamins include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist promptly. Iron in the medication may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug may occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, it's important to contact your doctor or pharmacist. In the US, call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. This is especially important to keep in mind if you have young children in your home. If you suspect that your child has ingested this medication, it's crucial to seek medical help immediately. Before taking Wescap-C DHA 35 mg, 1 mg, 200 mg capsule multivitamins, it's important to discuss any allergies you may have with your doctor or pharmacist. This product may contain inactive ingredients that could cause allergic reactions, so it's essential to talk to your pharmacist for more details. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have conditions such as iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin brand contains folic acid, be sure to inform your doctor or pharmacist if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia, which could result in serious nerve problems. It's best to consult your doctor or pharmacist for more details. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to discuss the use of this medication with your doctor. It's important to remember that this product may interact with other medications you may be taking. It's essential to keep a list of all the products you use, including any prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. This product can also decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of this product. It's best to ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your brand of multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs such as hydantoins. Lastly, this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone has taken too much Wescap-C DHA 35 mg, 1 mg, 200 mg capsule multivitamins and experiences severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the US, you can call 1-800-222-1222 for your local poison control center, while in Canada, you can reach out to a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has recommended Wescap-C DHA 35 mg, 1 mg, 200 mg capsule multivitamins, it's important not to share it with others. It's also important to keep all medical and lab appointments while taking this medication. Some brands of this product may also contain ingredients such as docusate. If you have any questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. It's important to remember that Wescap-C DHA 35 mg, 1 mg, 200 mg capsule multivitamins is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods, so be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take a dose of Wescap-C DHA 35 mg, 1 mg, 200 mg capsule multivitamins at the scheduled time, you can take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed dose and take the next one at the usual time. It's important not to take a double dose to make up for the missed one. Remember to take this medication at the same time each day for the best results. Make sure to store Wescap-C DHA 35 mg, 1 mg, 200 mg capsule multivitamins at room temperature and away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do so. Remember not to flush the medication down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.